Hello everyone, and welcome. Today, we will be discussing sleep disorders in the older adult population, a review of risk factors, challenges, and interventions by Emily Engel, Mackenzie Hartley, Hannah Sellars, Nikki Sipe, and Adrienne Wrenn for Nursing 321, Section 801, Gerontological Nursing and End-of-Life Care at the University of North Carolina at Wilmington with Professor Dr. Barbara Suzy Diggle-Fox. Our objectives for today's discussion first includes recognizing the significance of sleep disorders in the older adult population, identifying risk factors associated with those sleep disorders, discussing subsequent complications, and then investigating evidence-based interventions to help improve the overall sleep quality in the older adult population.
Sleep disorders are a very prevalent issue in the older adult population. In fact, anywhere from 40 to 70% of older adults experience chronic sleep problems. These rates are even higher in those older adults who have medical and psychiatric comorbidities. Unfortunately, comorbidities have additive effects on sleep disturbances. In other words, the higher number of comorbidities, the higher rate of sleep problems. Sleep disorders are a significant concern for the older adult population as they can lead to physical and cognitive impairments with subsequent decline in quality of life. According to Chan et al., unresolved sleep problems in older adults lead to poor quality of life, cognitive impairment, and emotional distress, as well as a decline in physical function and increased risk of falling incidents. An observational study done showed that sleep duration, sleep fragmentation, and sleep disordered breathing play a role in the development of cognitive impairment for the older adults. A few examples of physical impairments that older adults are faced with are difficulty ambulating, difficulty performing ADLs, difficulty with balance, difficulty seeing, and an increased risk for falls. Examples of cognitive impairments are decrease in memory, decrease in attention, and decrease in reaction time.
As clinicians, it is our responsibility to assess our patients for risk factors that may lead to these sleep disturbances. Some things that place the older adult at higher risk are personal or family history of sleep disturbances, obesity, smoking, hypertension, depression, and socioeconomic status. Older adults are less likely to report sleep disturbances because they believe that this is just a normal part of aging. Discussing sleep-wake patterns with a family member or a caregiver may prove to be more beneficial when assessing for sleep disturbances. There are many different assessment tools that can be used to assess the risk factors for sleep disturbances. But both subjective and objective data need to be collected to fully assess the risk for these individuals.
There are physiological factors that increase the risk for sleep disturbances. The amount of REM, or rapid eye movement sleep, has been shown to decrease in the elderly population. Sleep interruptions, such as waking to go to the restroom, are one interference to REM sleep. However, it has been shown that the body's level of natural melatonin decreases as we age. Younger adults have a peak of natural melatonin at night or after being awake for a certain number of hours. The elderly have a gradual increase in natural melatonin that only reaches about half the level of the younger adults. This lesser amount of melatonin does not allow for the body to obtain restful REM sleep.
Sleep is a state that provides us a break from the constant demands of life, and it's necessary for us to function. When we are asleep, we need to feel safe and at ease to be able to rest well. In this study, it showed that socioeconomic status plays a role in the sleep disorders in the older adult population. Most of the time, this stems from their current status as well as their status from when they were a child. Per Arbor et al., there are 4 mechanisms that may explain the socioeconomic patterning of sleeping problems. These 4 mechanisms include structural disadvantage, psychological distress associated with structural disadvantage, individual lifestyle behaviors, and knowledge of strategies to promote sleep. Structural disadvantage refers to the direct association between adverse material circumstances and sleep quality. A few examples of structural disadvantage include poor house quality and environmental effects such as noise or light. Psychological distress include examples of poor housing, unemployment, and low income. All of these things leading to stress, worry, and anxiety. It is noted that women are at higher risk than men to experience sleeping problems. Women are more affected by their previous socioeconomic status as well as their current status, whereas men only seem to be affected by their current socioeconomic status.
Lack of quality sleep can result in many health problems. When the body is not able to enter REM sleep for restoration, the brain is unable to reset itself. Quality sleep is considered a blueprint in mental and physical health, according to Gulia and Kumar, 2018. Lack of sleep can lead to depression, anxiety, increased risk of cardiovascular disease, dementia, increased pain, and physical disability. These health concerns can range from mild to severe depending on the person and the severity of their sleep disruptions. There is also the problem that many of these can be reversed. Lack of sleep can lead to anxiety, whereas anxiety can lead to lack of sleep. This also holds true with depression, pain, and cardiovascular disease. This can create a vicious cycle.
There are many evidence-based interventions that help improve the sleep in the elderly and decrease the risk of sleeping disorders in the elderly. These include physical exercise, melatonin agonist administration, warm foot baths, bright light therapy, foot reflexology, and sedative music. Poor sleep quality affects everybody's quality of life at any age. There was a study that was performed that proved that older adults who are physically and socially active had better quality of sleep and quality of life. This can easily be done by getting a gym membership. Gym memberships require the older population to also be socially interactive, and when they join classes such as water aerobics, they can also make friends. Physical activity also improves bone health and muscle strength, which also improves their ability to participate in activities such as volunteering and church activities. Physical activity also releases endorphins, which can decrease anxiety and decrease depression, which also makes it easier for them to fall asleep at night because they do not feel like their mind is racing. Another intervention that can improve sleep quality in the older adults is something called light therapy. Light therapy is not something that's crazy fancy. It's usually just sitting next to a special light box for about half an hour, usually upon awakening. These boxes include very bright lights that help people that have circadian rhythm problems. It has been proven to reduce nighttime awakenings. It also helps with regulating body temperature, alertness, and helps your body to regulate the hormones that causes you to be alert during the daytime and sleepy during the nighttime. Sometimes these things can get thrown off by people who like to take naps during the day. It works by activating the hypothalamus at certain times of the day, because I'm sure, as you know, the body has an internal clock and there are hormones that are released in the daytime that help you stay awake, and that's also why melatonin is given at nighttime, because that is a hormone that is released at nighttime along with darkness to promote sleep. And light therapy just promotes those hormones to wake you up and keep you awake during the day.
Many of the elderly population take multiple medications for various reasons. The safety footprints and side effects of many medicines can interact with other medications. Physicians try to stay away from medicines that can increase these interactions and cause problems. Melatonin agonist administration has become quite popular. Melatonin agonist has a great safety profile with very minimal side effects. With the decrease in natural melatonin that occurs with aging, melatonin agonist administration is quite an effective treatment option to assist the elderly in obtaining quality sleep. Melatonin agonist administration, combined with physical exercise, can increase quality sleep in the elderly population.
A 6-week study was published in the Journal of Gerontological Nursing that determined that foot reflexology, when performed twice a week for the duration of that 6-week study, proved to improve the sleep quality in the older adult population. Now, there is a difference between a foot massage and foot reflexology. Reflexology applies deeper pressure in specific areas that correlate with different organs and different parts of the body. These specific pressure points stimulate blood flow and provide a sense of relaxation. These can even improve healing in the systems connected to the specific areas. This intervention was performed 2 times a week in 30-minute sessions, performing 15-minute sessions on each foot. This stimulation provided relaxation and ultimately proved to improve the sleep quality of the older adults in their group of this study. This same 6-week study that determined that foot reflexology helped improve sleep quality showed that warm foot baths are beneficial to improving sleep quality among the older adult population. These participants would soak in a warm foot bath for 10 to 15 minutes, 1 hour prior to going to bed. These warm foot baths dilated the blood vessels in the feet and resulted in improved blood circulation, pain relief, and had an overall healing effect for these individuals. This intervention proved to relax the body and mind and promote improved sleep quality for the older adult population in this group in the study.
Another evidence-based intervention for improving sleep quality in the older adult population is music therapy. Specifically, listening to sedative music with a slow tempo of 60 to 80 beats per minute with a smooth melody at a soft volume for 30 minutes to an hour a day for at least 4 weeks will improve sleep quality in older adults aged 60 and older. Such sedative music is thought to reduce neuroendocrine activity in the autonomic nervous system, which increases relaxation and distraction responses, resulting in reduced anxiety and improved sleep quality. Interestingly, studies report that listening to music modulates body rhythm by slowing it, thereby reducing sympathetic nervous system activity and circulating noradrenaline levels. In addition, deep relaxation and calmness of the body is promoted due to this physiological change, thus improving sleep quality. There is also current evidence showing a cumulative effect on improving sleep quality with long-term music therapy. Not only do the authors prove that listening to music is an empirical-based intervention for improving older adult sleep quality, but they also highlight other positive aspects of music therapy, such as the ease of administration, little to no cost, no harmful side effects, it's pretty safe, and the potential to reduce the need for or dependence on sedatives and sleeping medication. Consequently, music therapy proves to be a very promising intervention for improving sleep quality among older adults. In conclusion, sleep disorders are a significant concern for the older adult population because they can lead to physical and cognitive impairments, resulting in an overall decline in quality of life. Consequently, nurses must pay careful attention when assessing and reviewing risk factors, as these details are imperative to enhancing sleep health for older adults. In addition to the common risk factors, nurses should also recognize physiological changes and assess the older adult's socioeconomic conditions. The older adult population may suffer from depression, increased pain, as well as cardiovascular and dementia symptoms as a result of sleep disturbances. Proposed interventions include physical exercise, bright light therapy, melatonin agonist administration, foot reflexology, warm foot baths, and sedative music therapy. These evidence-based interventions can be used to help decrease sleep disorders among the older adult population. We hope you've enjoyed our presentation, and thank you for joining us.